Well, regular dentist visits can do more than just keep your smile attractive. They can tell dentists a lot about your overall health, including whether or not you may be developing diseases like diabetes or even a heart disease. Research old and new suggests that the health of your mouth mirrors the condition of your body as a whole. So today we start our Smile Now segment with Dr. Swati's sister. So welcome, Swati.
Hi, thank you so much for having me
We
in here.
cannot learn enough about oral hygiene. So what are you going to talk about today?
Well, I'm going to be talking and touching a little bit about bleeding gums, which seems to be the most common issue most people have, and there is...
Even I have it actually.
Trust me, even I have it. So being a dentist, I know, so I take a little more precautions. And
so bleeding gum means you wake up in the morning, you brush your teeth, and when you spit out, you see a little blood.
yes, as
It
you're
doesn't have
brushing-
to bleed whole day.
No.
The morning bleeding itself is a
It's a sign,
indication.
it's an indication that, well, you need to take a little more of a precautionary step, go to the dentist and get your simple cleaning done, because that's the first step to avoid bleeding gums.
Okay.
Well, there are a lot of causes for it, but the main thing which we see is poor oral hygiene. When I say poor oral hygiene, it's just that neglect. Sometimes patients don't brush twice a day, which is most often the main cause. And just a tip, it's good to brush twice a day.
Okay.
Good to
Remember,
brush
Cheryl,
and
twice a
floss.
day.
I brush and floss twice a day. So.
It's something which is just like eating. We eat meals at least 3 times a day, so why not brush twice?
Okay.
I mean, that's a good tip.
There's no dieting when it comes to brushing.
No.
Go overboard.
Cannot skip that. Yes, absolutely. You can always do it more.
Okay.
But aggressive brushing again is not very good. So, do subtle, use a soft toothbrush and do the right technique of brushing, because that's another thing which causes harm. If you don't brush properly, a lot of people, like my patients come in, oh, I brush 3 times a day, I'm still having this issue. I said, you're not brushing right. So it's just not brushing.
When we're talking about brushes and bristles, I just wanted to touch a little bit on all these electronic gadgets that have come
Yes.
out. Can you quickly say a little bit about if they're good or not?
I would definitely recommend it. I use it myself, so it's like I practice what I preach. It's nice. Only thing with the electronic or those battery operated brushes, it's just that you have to keep a watch. You cannot force yourself when brushing. Let the battery do its job.
I know, but there's another machine called the Waterpik. What about
Waterpik is great for those. Actually, it's not meant for all, I would say. I mean, in my opinion, it's meant for people who have got very wide open teeth, or food gets stuck for long. Many patients have this problem. People say, food is getting stuck as soon as I finish eating. I said, just use the Waterpik and it helps you cleanse, because it's like using a floss, but it's a better aid for big spaces, because it gushes out, it cleanses well. So that area is clean then. So Waterpik is a good aid. It's a good aid.
So now going back to bleeding gum, gingivitis.
Gingivitis,
That's correct.
yes.
Yes.
What
It's
about
the first stage of bleeding gums is gingivitis, but you have stages beyond that, which leads to periodontitis. It's just not gums then, it's tissues all around the gums, and that's a little scarier.
including the bone that they are
Yes,
in?
absolutely. The teeth are embedded in bone, so it's like a concrete for for the tooth to hold on, you need bone. Now, if you have something called as periodontitis, which is just not tissues around the tooth, but even the bone is involved, then the bone becomes soft, and you start losing bone. It's just like in adults and some youngsters, we have something called as osteoporosis, where the bone starts
Right.
regressing,
That's your
something like
body
that
bone,
in the
yeah.
teeth,
Yeah.
in the teeth. And that's just most often, I would say, it's because of the neglect from our own cells. But of course, there are attributing factors like some systemic diseases which add on to it. If a person is a little more conscious and takes a little precautionary measures, then this problem can be avoided, I would say.
I know that a lot of pregnant women feel that their gums bleed more.
It is. It's because of hormones.
Okay.
Like in pregnancy, you do have different hormones which actually exacerbate a little higher and those definitely cause gingivitis, periodontitis. When I say periodontitis, it's a little advanced stage of gingivitis. And you have swollen gums, just not bleeding, but they have swollen gums. And most often after pregnancy, once you have postpartum, it does decrease. But we definitely, I insist at least 4 times, every 4 months, come for a cleaning. It's helpful.
Do you want to touch upon what is the right age or the condition of wisdom tooth when it's a must that it has to be taken out?
Wisdom tooth is another thing which many patients complain of. I mean, the right age. There is no right age for a wisdom tooth removal, but you know,
You
when
don't
it's-
have to be wise for the wisdom
Absolutely.
removal.
Sometimes they say, "Oh, am I losing wisdom?" I said, "Not at all. You're staying wise still." But it's good when you're in the teens. It's very good to take it out because that's the time when the tooth is kind of easy and the bone is very elastic, so the tooth comes out much faster.
And the recovery is
easier.
faster.
Oh, way much faster.
Everything when you're young.
Yeah,
I feel it.
Absolutely. Now, Swati, do you have to go to a specialized dentist, or any regular dentist can take out a wisdom
Tooth?
Yeah.
Most often it's the specialists who take it out, but there are a few who are, if it's an easy removal, then yes. If they're competent and they're comfortable doing it, then the general dentist also can do it, but it's the general dentist's discretion most often. But if it's complicated, I wouldn't even bother. I think a specialist, because they're trained to do that, and they
Right.
have gadgets to do it.
Better go to the specialist, Jaya.
I know if there's a complication, it's better to go
I
there.
would definitely do that because they know how to handle it a little better, and the office is equipped for that.
So, Swati, about wisdom teeth, you know, that's a thing a lot of people are concerned about. They worry about it hurts them, it's there. And of course, a lot of people say that they might actually be losing wisdom when you take it out.
Yes, absolutely. That's one of the biggest myths people have, that losing wisdom, not at all. But it's good to take the wisdom tooth out because sometimes it causes pushing, it causes more crowding. And, you know, there is no age limit to take it out, but it's the best age is when you are a little in the adolescent teens, like 17, 18, because the tissue is soft, so bone is really elastic, so the tooth actually comes out much better. And then they go on for, you know, getting their teeth straightened and so.
And
so
I think
on
kids
so
recover from all these
Very
things much
fast.
faster, right?
Don't
Much
we know
faster.
that,
We know that with age, we know how
Yeah.
we suffer.
And they can do it in one go. Most often, all the specialists do it in one go, so it's much easier.
And like we always hear that, you can mess with God, but you can't mess with your teeth.
Don't mess with us.
And we have Swati to take care of that, right,
Absolutely,
Swati?
anytime.
Yeah, we have to bring you back again very soon.
It was a pleasure. It was a pleasure, and it's nice to educate people because it's only education which goes a far way off.
Particularly in our community, because we
Yes.
didn't grow up knowing that we have to
Ignorance.
take care of our teeth this often.
So thank you so much, Swati.
Thank you. It was a pleasure meeting you.
So viewers, basic prevention can keep your teeth and your whole body in good condition. Neglect can cause a small issue to become a big problem. Remember, keep your teeth healthy and keep the focus on your bright, sparkling smile. So take a quick look in the mirror and we'll be right back.